properly. So when we say systems are in place, we have 11 systems. Sometimes it is termed as 10 with sensory as a different thing, but in general we call it as 11 systems. It contains digestive system, it contains respiratory, cardiac system, all the systems. When they work together in synchronization, then only body will be well kept and we will be disease free. What happens to the body? What we are doing in day-to-day life matters a lot for the body. What happens is that if we have stress, if we have strain, if we sleep less, whatever our pattern is there, if you don't follow that things, and if we have if you don't follow dietary things, then what happens is that our cells get little bit discharged, we can say. The charge is reduced. When the charge is reduced on many cells, what happens is that the system or that organ or the tissue or that muscle system that underperforms, and that underperforming, if it is kept for longer time, we get disease. So we will have a short video showing that how the body is electrified and what do we really have some voltages or frequency. Because next after that video we will be speaking about the device which runs on the three principle of current, voltage and frequency. So we will have that video first. Priyana, can we have the video?
I'm just going to take a couple of seconds, please.
Yes.
Introducing eMedica, health in your hands. Did you know your body is electrified? Did you know your blood cells carry voltages? Did you know every disease works on its own optimal frequency? Nikola Tesla once said, "If you want to know the secrets of the universe, think in terms of energy, frequencies, and vibrations." Suppose you're listening to the radio in your car, and you don't like the music. What do? You change the frequency. What many people fail to recognize is that we can take charge of our voltages and frequencies exactly the same way. We believe our bodies are made of flesh and blood, but everything on this planet, animals, plants, and water are made of atoms, which emit and receive energy and operate on specific voltages and frequencies. All our tissues, cells, and organs have their own unique electromagnetic field. Viruses and bacteria also work on specific voltages and frequency. It has been proved that a normal cell voltage is 90 millivolts. Reduced voltage leads to various diseases. Correcting cell voltages with specific voltage and frequencies would be an answer for many problems, which can heal naturally without using chemicals. For example, cell voltage below 50 millivolts leads to various diseases, and cell voltage below 30 millivolts is a cancer cell. The same way a healthy person has a frequency of 62 megahertz to 72 megahertz. When the body frequencies drop, then we are prone to various diseases. For example, if your frequency drops to 58 megahertz, we are likely to have a cold and the flu. If it drops to 42 megahertz, we are prone to cancer. The lower the frequencies, the closer we are to death. eMedica is an ingenious invention designed to provide dedicated voltages and frequencies. We have put together the collections of voltages and frequencies which could be an answer to all your health problems. eMedica is a unique device which would monitor and cure on the same platform, which would also maintain your health records using a cloud platform. We are in the process of developing a smart wearable device which would also monitor all your activities like sleep, calories burned, etc. eMedica monitors real-time health parameters like ECG, PPG, SpO2, and blood glucose levels using an IoT platform. In case a disorder is recorded in the human body, The device would obtain required programs to stabilize the condition using artificial intelligence. eMedica.
Yes. So we saw something which is new to everyone. This technology is totally new. It is innovative, and we don't have any device, medical device which has uniqueness of this device. Like, we have a device which works on voltage, current, and frequency. We don't have any other device in the market which have these three-dimensional figures. Now, when we have seen the video, we have seen that we have voltage, so we need to keep it. So what happens when we use the things? What we do is, with eMedica, we run the program, and that program is run through the machine, and we need to use machine in a way that our foot will be resting on the machine, and we will have two bands on our hand touching the palm, which will receive the program from the machine. So we will have that video also. After some discussion, we will show you how to use it. But till that, we will have a technical thing, which is a program. All programs are based on voltage, current, and frequency. So primary thing, what happens with the use of eMedica is, the current flowing through the body, it goes to the bloodstream also and to nervous system also. It keeps charging nervous system and all body cells. Surplus to that, what happens is that when it flows to the blood, that current burns the fat which is there in the bloodstream. So with the first effect, what it does is it improves the blood circulation. It starts improving it by burning the fat. So it can burn the fat which is there in the blood, plus which is stationary in the blood vessels, which cannot be detected easily with the blood test or any ECG or something. So that can be done. Plus, the voltage is going to give the required voltage to all the cells. While doing this, when we are using disease specific program, the frequency comes into play. Like we have seen in the video, we change the radio signal and we get that, change the channel. What happens in that radio, you can take FM or whatever it is, what happens is that frequencies are already there, and what we do is that frequency we just match with our radio frequency, and we get to listen the music or news, whatever it is. So that we do because that frequency is resonance is there, same frequency. Similarly, all our disease specific programs will have frequency which will be correlating to the organ or the cells which are diseased. If you take an example, we have beta cells in pancreas which are responsible to produce the insulin. So when we use our program for diabetes, that frequency in that program starts resonating with the frequency of beta cells, and it starts activating, or we can say rejuvenating the cells, beta cells. So insulin production can be improvised in that. Surplus to that, this frequency will have organ. So that is very helpful when we say that we target the root cause. None of the medicines can target the root cause very easily. So we can do it a very finer way and from inside. So best thing is that to go inside the body and do the healing. So we are doing it in a very different way, very unique way, and very innovative way. So when we say we are having a good program which is charging our body and which is having impact on the all our systems, one thing I would like to show you, that this, if you can see the image, we have shown in the table we have shown the voltage value. Our cell should be electron donor. If you see the yellow thing, it is electron donor. If you go to the negativity, it gives on giving the electrons, more and more electrons will be more and more healthy cells. And if you go towards downwards, if the electron stealer, it will start stealing the electrons from other cells, and there can be clumping of the cells, which is very dangerous, and we can get a disease. And if it goes more below, then it can be a cancerous cell. So what we do with the eMedica is we try to keep this cell value to the optimum level where we can easily maintain our body. Now coming back to the body systems, Dr. Bharti will be able to explain you how it works and how it can help you to get rid of the diseases by targeting the root cause. Over to Dr. Bharti. Doctor, you're not audible. Please raise the voice. Yours is mute.
Hello, everyone. Hope I am audible now.
Yes, now audible.
Yeah, okay. So as Mr. Swapnil has explained you how the device works, it works on the voltage, frequency and current. So apart from that, what your body needs is the negative ions. And those negative ions are delivered through this device when you keep your feet and put the bands on your palms. So what do these negative ions do exactly to your blood? First thing is there is a little temperature rise in the blood, which should naturally happen when you get exposed to some bacteria, viruses, or some foreign thing which is not useful, which is harmful for your body. So this thing, if you use this device on everyday regular basis, the blood temperature kills the viruses and bacteria then and there only, and that infection is not increased to a disease, to a level where disease is formed. This is the first benefit, which can be achieved with everyone who is sick or not sick. This is preventive also. And as these days we have spent last 3 years struggling with COVID infection. So this can be so much useful for COVID also and all such viral and bacterial infections. Second thing is it increases the body temperature, and it also relieves the pain and inflammation which is there in the deeper cells of the body, like the muscles, the tendons, the organs of the joints. They can have inflammation inside which is not known to you also, but when it increases the to a level where you can also feel the pain, so before that only it will take care of the inflammation. This is the second benefit. Apart from this, whatever you eat, all the nutrition from your food will be circulated through your blood to each and every cell of your body, and it will give you the optimum maximum benefit. Whenever you are taking healthy food or taking some supplements, if they are not reaching to the cells, then they are just excreted out from your body without giving you the benefit of that supplement. So this will be also increased. So whatever medicine also you are taking, you will get the complete benefit of that medicine, and there will be no need to increase the dosage after certain time. On the other hand, you can also, the medicine can be reduced instead of increasing. This is the another benefit. Then what happens, when the circulation, the body circulation increases, it increases the circulation and oxygenation also. So it helps your body to get more oxygen, your lungs get more oxygen, and each and every cell of your body is oxygenated. This is the same effect which happens when you deep breathe or you get a massage done. If you if you have pain somewhere, you rub that area. It increases the circulation and increases the oxygen, and that is why the pain is relieved. So this is taken care with the device itself. Apart from this, we have these are general benefits, and also detoxifies the body. The toxins which are there circulating in your blood, they are getting out on everyday basis, and there is no accumulation of toxins. And the benefits of detox. Whatever natural treatments which are available, they all work on the detoxification principle. Apart from this, these are all preventive benefits which I am talking about. Only these benefits cover so much, 90% of the diseases are cleared. It dissolves the blood fat, and that is why the blood vessels, they are kept clean, and there is no plaque on the blood vessels, and that plaque only itself gets the clotting and cardiac arrest and brain stroke and many other diseases. So that is also taken care on everyday day-to-day basis. Apart from this, we have dedicated frequencies, combination of voltage and frequencies, particularly working on the particular disease like diabetes, thyroid, blood pressure, then cardiac diseases, and many more. There are about 3,000 plus diseases, including autoimmune diseases and skin disorders, which are very chronic and difficult to treat with allopathy, especially because that increases the response of the cells when you treat. And there is only steroid treatment available for these diseases, which is again harmful and which has many more side effects on your body. So all these diseases, I will talk, whenever you will ask me questions about particular diseases, I will answer all of them. Now I'm taking it like a general this thing. So we have this natural, non-invasive solution for all the health problems. And when this is a family wellness device. When there is a sick person in the family, for him we can give the particular diseases pre-programmed in the device. And at the same time, other people who are not having any disease, if they use the immunity program, they can keep away all the infections, all the diseases, and they can get increased energy levels, better sleep, and better stress-free mind. So these are the general benefits. Now at the end of the session, if you ask me questions, I will definitely answer them according to your queries. And also there are only 3 conditions where this device cannot be used: children under 8 years of age, then pregnant women, and people who have pacemakers or any electrical pulse generating device inside their body. Only these 3 categories cannot use the device. Apart from these, at any age, you can use the device. We guide you how to use it, how much time. It is 30 minutes to 90 minutes. And we guide you according to the severity of the disease. And based on your reports, we give you a prescription, like you have to use this 2 hours or 3 hours a day, separated in 1 hour session. And that you can use very easily. You can do your own work. It is not like you have to spend that time specially on the device. You can read, you can see, watch TV, you can do your work, anything can be done. And also you can use mobile computer also when you are using the device. So that is also not prohibited. It's an easy way to keep your body healthy, disease free. And if you have a disease, you can also keep it, your medicines, you can get reduced after a certain time of usage. So over to Swapnil now.
Yes, thanks, doctor. And before proceeding for further information about the device, I would like to show you a video which shows that how the device can be used. Rihanna, can we have the video, please?
Hi, I'm Kritika. The objective of today's video is to show you how to use eMedica and heal yourself naturally. The device has power cords that you connect to the respective connector. It also has 2 hand cords in 2 colors, red color and black color, that you connect to its individual connector. Once you've connected the hand cords, you put on the bands just like this, facing the front of your palm. Do not put them at the back of your palm or anywhere else for that matter. They come at the front of your palm. Very important to remember, have 2 glasses of water before you start the device, as the water increases your conductivity and gives you a very optimum healing. Remember to have a bottle of water near you, because once you start the device, you cannot move. You have to log in the code for your individual challenges and also for the time that are very clearly mentioned in the manual. eMedica asks you to use it for either half an hour, 1 hour, or any number of time periods, But the advantage is that you can take breaks between those. Use eMedica for half an hour, go take a walk, have rest, come back and use it again. Just remember, for the same challenge, you can use it continuously, but in case you're facing two different challenges, take 2-hour gaps between two different sessions. If you have sensitive skin, remember to wrap a handkerchief before you put on your bands. eMedica cannot be used by people who have pacemakers or any electrical device for that matter. But the advantage is that it can be used by people of all sorts of age, be it elderly or young, even people who have metal rods inserted. Use eMedica every day and enjoy its benefits and its optimum healing.
Yes. So now the demo is also done. For just have a look of the machine. Now we will speak about the little bit about the benefits. Benefits. First benefit is it improves the blood circulation and nervous system. See, if you take a pin and prick anywhere in your body, excluding hair and nail, what we get is just sensation and blood. So blood comes out and we get a pain. So everywhere these two systems are there. So if we can target these two systems, we can target other all systems which are there, should be synced with other things. So that can be easily done. So what we do is we do with the thing which is targeting the root cause with the systems which are everywhere in the body. So other benefits are we have program for immune, so we can improvise our immune, we can control the blood sugar level, we can control blood pressure, and if we use it for regularly for longer time, the pH, which is a very much concern in the case of acidity and other related diseases, that can be maintained. This machine is now not having any side effects as it does in a natural way. It gives just electrons and the frequency which is very much selective to the cells or the organ, and it is a non-invasive way. And when we are speaking that it is giving electron, just going giving electron, not other the medicine or something like that, it is a very but natural way. So these are the things. Now how it can help you is the thing, just improvising the blood circulation, we can improvise our oxygenation, so oxygen will reach to all cells, because of it goes to the bloodstream only. So any cell in the body requires blood, oxygen and nutrition, and if it is diseased, it requires medicine. So when we improvise the blood circulation, it has an impact on overall all the 11 systems, in which first is the respiratory system, where we get good amount of blood in our lungs, so gas transfer is proper, there is less amount of fat, or we can say a plaque in the blood, so it flows properly, so it reaches everywhere in the body properly. So oxygenation is proper, then oxygen and blood can reach easily to all the cells which is required. Similarly, while using this, we are charging the body with a electrical charge, which will charge the muscles, tissues, everything. So it can impact on our digestive system, it will improve our digestive system. When digestive system is improved and we will have abundant blood in our intestine, the absorption can be proper, so that absorb nutrients, or in case of disease medicine, it is digested in the stomach and it goes to the intestine for the absorption. It can be absorbed and it can be distributed properly to all the cells, which when we do it in a regular way, so what can happen is whatever is required for our cells, we are giving that surplus, we are charging the cells by electrical way, which electronic way I can say, and in a very small current is passed, so no need to worry from the side effect or whether I will have a dead cells. No, nothing will happen with the body in that case. So we are doing it in a very proper way, very confined way, and we can say very precise way, we can say. So this is the thing about the eMedica. Now I will give it to Priyana for closing. We can have question and answer session after the sorry.
Yes, thank you so much, Swapnil ji. Thank you so much, Dr. Bharti. We are going to call you back again if there are any questions from our guests. So, Miss Madhu was asking us if it's been proven, like it's been proven or not. Yes, yeah, she has asked Dr. Bharti, do we have any medical records, proof authentic, or any substantiate for the benefit you are referring to? Yes, we have, sir, ma'am. We have clinical trials done privately, and government clinical trials are going on right now. And apart from that, we have various testimonials and lab reports, like before and after lab reports, from the authentic, diagnostic centers like Suburban, Thyrocare, and many others. All the authentic, labs from where is being actually taken. So what we do is, when we give this device to somebody, before that we see whether the person is whatever problem that the person has. That report, we get it from the lab, so from the diagnostic center, and based on that, we Dr. Bharti prescribes them what exactly the program that needs to be used by that patient. And after the usage of 30 to 45 days time, we see a visible change in their health and health parameters, and their energy level, and every other thing which they can feel. And also, apart from feeling, we see it on the test reports. So this is how we have done it, and we have various clinical researches which has been done privately. And yes, right now it's going on in government sector in Maharashtra. So, ladies and gentlemen, we are going to open a session in some time. But before I go ahead to open the session, I would like to introduce you to our VP Sales, Miss Pooja Tiwari. If you can just show yourself, Pooja, there she is. I would request you to say a few words. She's our VP Sales from Delhi. She's right now in Delhi. And yes, Pooja, please go ahead.
Hi, everyone. Good afternoon. Thank you all for joining. And it was a great session. All of us, I think Dr. Bharti and Swapnilji have shared their all the details regarding the eMedica. We'll be more than happy to assist all of you. If you have any queries, our team will be in constantly touch with you. Do let us know if you have any queries. And thank you once again for joining us. Thank you.
Thanks, Pooja. I forgot to introduce myself. My name is Priyana. So I'm the host of this webinar. I am handling the marketing. So I'm the VP marketing. I'm right now posted in Mumbai, and so I'm glad to be a host and the moderator for this webinar. And I would also want Jivika and Reshmi to say a few words to all their guests. Why don't they just uh, say hi to all your guests and say a few words. So we can start with Reshmi.
Hi, hello everyone. This is Reshmi from eMedica. Thank you so much who have joined with us today from your valuable time. I will send you all the details which you have asked for. Thank you so much once again.
All right, Jivika.
Hello everyone. A very big thank you for investing time to understand our device. It is a wonderful device. We would like to connect each and everyone in personal. For any other queries, you can, be anytime available, over the calls to solve any of your queries. Thank you so much for joining.
Thank you, Jivika. Thank you, Reshmi. So right now we are opening this session for questionnaires. Like, you can ask any query that you have to ask us. Reshmi, you can go on mute. Thank you, Reshmi. So Reshmi and Jivika is from Mumbai team, and right at the moment, as Dr. Bharti and Swapnilji said, that this technology is of three, parameters, three technologies, which is frequency, current, and voltage. This is how, in a very natural way, our entire body itself is electrified. We just transmitting the correct exact voltage and exact frequency which is required for that particular organ, that is being transmitted through this device. Now this is the entire thing has been researched, tested, and then it has been programmed and is being set in each device. So I have a question from Mr. Sunil, who is asking, how many versions do we have? So sir, we have more than 50 versions, and out of which we have more than 3000 disease programs are there. So out of 3000, we have around, I think, 50 plus programs which is being diversified in various versions. So as per since it's a family device, in each device we have 12 programs, and in that device, every version will have 4 to 5 basic problems which is there, lifestyle problem or a chronic problem which is there in every house almost, like diabetes or cholesterol problem or an immunity boosting program. All these programs and few more others are there, like cough and cold, even virus gets killed through this. Like we have treated so many COVID patients through this without any medicine at all. So the best part about this device is that is not only treating you naturally with your own parameters, is correcting the cell parameters and treating and eliminating the disease from the root itself. So that is the best thing naturally we are doing. And not only this, we are also reducing and almost eliminating the side effects of the other drugs that we have been using all these years. So yeah, so that's the answer to the question Mr. Sunil has asked. So I would like to open the session to ask questions. Sunil ji, you can please come forward, or anybody else would like to ask any question to me, Swapnil ji, Pooja, or Dr. Bharti. Please feel free to ask. Okay, now there's another question. So Sunil ji has asked, can we get all program in one device, or should we use all device? No, sir. So basically, we will have 12 programs in each device. So for a family, usually not more than 12, diseases are being there. It affects your family. So we have 12 program in only in each device. More than that is not possible. We are not putting it. As per your, now if for example that particular device doesn't have that particular disease program that you are desiring or is required, we can customize that. That is not a problem. We can even if you have taken it and you have bought it and it is there with you for a couple of years or months, and after some time you discover that there is another problem which has occurred in your family, that can be given back to us. We will customize that and give it back to you, eliminating one particular program which is not really required in your family. So that way we can customize it.
Hi, this is Janak from Bangalore.
Hi.
Hi. So I understand this is works on various devices, and then you can see the change. So is it like we can take it as a reversal, or it will be like if you after a year or so, like if you stop, then the things will be coming back, or and also like how much time does it require to show the change? Say for example, I have a diabetic problem. Okay, so if I start using the device, like how much days or how much time it will take for you to realize? Because I have worked on this through many other diets and other things. I know exactly what problem I have, and I know the report. I have everything bunched, and I know whether this device works or not in the next couple of months. Okay, but I'm asking, like, is it like you need to use it for how many days to see the change?
Right. So Dr.
Doctor can answer.
Swapnil
Yeah.
ji, yes, please go ahead.
Yeah. What happens is that, see, we cannot predict it without reports, firstly, and secondly, we don't know how much damage is done from the inside to that particular organ in case of any disease. So it takes at least 1 month to 3 months to see the actual results. In case of diabetes, if you see the report of HbA1c, we will be able to say that okay, after 3 months you will get the change in the report.
Sure. So just for say for an example, I have a HbA1c done last week. So mine is 7.1. Okay. Okay. So this is not high, or it is like a little bit.
Start off. We can start off diabetes.
Okay. So this is there for the last 10 years, the same thing. Last 10 years.
Yes.
Okay.
Yes.
So I wanted to make it to below 6. And if I go on a strict diet, I can definitely make it. But the problem is what you mentioned as a consistency. Okay.
Yes.
So consistency, assuming that if I take it, and can I use it for 2 months and see like if this the average is going down, and then probably see, we are not sure about the cost and other things involved. So assuming that, can we use it for quite some time, and then we have some plan like whether this is working or not working or something like that?
The changes in HbA1c will be seen approximately after a time of 3 months. because HbA1c is your sugar control over last 3 months. So when you will take a test after 2 months, it will show the 2 months of using the device and 1 month back. I mean, before the
Right.
device usage. And definitely, see, diabetes, if it is chronic, like 10 years you are suffering from it, it has some effects, permanent effects also inside your body. Like there is a nerve damage, which
Right.
you must not have felt right now. I don't know. We will talk about it when we will get in touch. So this damage will be taken care of after the blood sugar control. So it will be like step by step. Like first, your day-to-day blood sugar will come down. Then over a period of 2 to 3 months, your HbA1c will come a little down. Say if it is 7.5, it will come to 7, and then 6.5, and then 6. And it needs consistency, definitely, because this is a non-invasive and this is a gentle kind of treatment. And for that, you will have to continue your medications for definitely for a certain period. After that, if we achieve this sugar control with less amount of medication, if suppose taking 500 milligram of metformin now twice a day, at least we can make it once a day. Then other medications also will be there supporting the main medication, that will also be reduced. And then over a period of time, you will be using only device and controlling your diet and lifestyle to a like normal level, not a very strict diet, but a healthy kind of diet. You can reverse the diabetes, because till now people were thinking, like the allopathy had emphasized this on the lay people, that diabetes cannot be reversed. If you have diabetes, it is for lifetime. But it is not so. And now many scientists have discovered that you can reverse the diabetes. Only thing is, you have to take a little efforts and do not depend on just medicines. Because if you are not adding something which is natural to the normal medicine course, it is not going to happen. Because after a certain period, if you remember, before 10 years you were started with a certain amount of medication. After 2 3 years, that is not working. So a little bit of increase will be there in the dosage of medication, and this will go on. So your body is getting dependent on the medication, and the natural function of your beta cells, your pancreas is not it's not functioning, because it is getting ready solution. So when we work on the device, when you will start using it, your beta cells will start producing the insulin. The insulin resistance of rest of your body cells will come down, but it will take place slowly. So it is the time period will be anything between 3 to 6 months, to see the change in the reports. And after that, definitely you will be continuously using the device, but the timing may be reduced. Like in the beginning, if you use it twice a day for 2 hours, after a certain time, when the medication will come down, you will be using it only once a day also. And there is no harm in using this device, because it will also prevent other diseases. Most of the times, the diabetes is associated with cardiac diseases and kidney diseases. So if you are able to control the complications also, it is a win-win. So I hope I have answered your queries.
Doctor, one thing.
Yeah.
So I've been using this device for 1 month, and I'm not. I'm a pre-diabetic.
Okay.
A1C is 6.
Huh.
So I'm using for half an hour.
Okay.
And after using, I feel some numbness in my feet, lower feet. Not numbness, actually, some type of feeling that
Okay.
I feel the whole day.
That should not be happening, because it may be like you are sitting in awkward position. So just keep your feet relaxed when you place the feet on the device. Keep your knees at a very convenient angle. That should take care of this. And also make sure you are drinking water throughout the day also, and before sitting on the device also.
Before sitting, not while taking the device.
Yeah. While taking treatment, also you can sip water, no problem. But before that, if you drink at least a glass of water, it will help.
So half an hour I'm taking the diabetes program and half an hour I take the immunity program. Is that
Okay.
fine?
Yeah, that is fine for now. And
Okay.
take it twice a day after your meals.
Yeah. So half an
Within
hour
that.
and half an hour in the
Yeah.
evening.
Yes, I will add to that. Madam said that you sit in a relaxed position. See, what happens is that when you are taking the treatment, if your legs are at right angle,
Yeah.
blood flow is little less to the lower side.
So that is why numbness is there.
So that's why, yeah, that's why that can happen. That can be one of the reasons. Because see, we
Okay.
are improvising the blood circulation, so it should not happen that you will have numbness in that. You will
Yeah.
get charged there. But what is happening is that blood is not reaching there. And again, water is also important. And
Okay.
if you are, if you have done the test for electrolytes, share us the report. Otherwise,
Okay.
you get it done. It is possible that it can happen because of that. And the thing is that now summer is coming, so you need to be little careful with the water content.
Okay. So how
Yeah.
much water is required to have in a day?
At least 3 liters minimum.
3. Okay,
Yeah.
fine.
And
Okay.
if you are going out and in a very what you can say sunny day and around 11 o'clock or 12 o'clock or in the afternoon, what you can do is you can if you're not more with the sugar, you can have electrolyte of things. Sugar free, you can take something electrolyte.
Okay.
Not sugary electrolytes you can take.
Okay. Thank you.
Yeah, because
Thank you.
that will help. That will help. See, what happens is that with that ions it will work. So it will have you will have better results.
Okay.
So keep hydrated. Keep yourself hydrated. That is the thing.
All right. Okay.
The
I'll do that.
key of use is keep hydrated. That is
Okay.
the thing.
I'll
Yeah.
try with that. Yeah. Thank you.
Thank you. Sunil ji, no, sorry. Uh, Prarthana ji has she has asked if it's a diagnostic. Does it give any diagnostic results? Also, no, ma'am, it doesn't give any diagnostic result. It's just a treatment device. But as of now, it's just a treatment device which we prescribe. Our doctor prescribe it to you based on your reports. As I said before, from the diagnostic centers. So based on that, or based on the medicines that is being prescribed to you if you're having a chronic or any other lifestyle disease, based on your prescription from your doctor, we advise, or our doctor advise or prescribes you the particular program that needs to be used for how many hours, how many days, and how much time that can be, and which are the program that needs to be used in your case. Everybody is different, so their acceptability and their time period may differ a little bit here and there. So we have seen people who got visible results in just 1 month time. We have seen in 15 days time. We have seen people in 3 months time. So everybody is different, every body is different, because how many depends again how many years you are suffering from, or what are the medicines that you're using. Based on that, how much damage is being made by the side effects of the other medicines. So we are not discouraging the medicines, because immediately only these allopathy medicines are going to help you out. But it is something which not only treating you non-invasive and naturally, our machine, our device, eMedica, but also the medicines that you have been using all these years, or if you're using right now also for everyday purpose, that the side effect of it gets reduced to the maximum level. So that is one of the thing. And in future, yes, just want to give you good news. I feel like telling it, in future we are going to have this device which will be giving you live it will be diagnosing your body parameters and giving you the solution immediately. Very soon we'll be launching that. Just have to wait for that until Mr. Rohira comes up with that device and launch it worldwide. Yeah.
Yeah, just to add that it will have real-time reports.
Yes, real
And
time.
those will be stored in a cloud platform which can be referred afterwards. And treatment also will be done according to the element only. So that is going to happen sooner, and it will be a wearable device. So you don't need to carry big thing or something like that. Just you need to wear it.
But that's a future thing. But as of
Yes.
now, we have this. It's a first
Yes.
generation device that we have
Yes.
launched.
Yes.
Yeah. And you see, so I was just asked if it is what's the warranty and guarantee. So we have a warranty for 2 years, but then it is a family device that is an investment for your next 10 years time. And any changes that you would want to have, you can get back to your health advisor or the sales team who's been in touch with you, like Jivika and Reshmi. They will guide you. Even after sales also, the service will be given without any interruption, or there will be no complaints at all. If there is any complaint, we'll take care of it, just in case there is any, that can be taken care of. As of now, we have 99.7% of success rate. So we have excellent results from everywhere. So if you have any other questions, please feel free to ask us.
Hi, Priyana. This is Madhu.
Yes. Hello, Mr. Madhu.
Yeah, hi. I'm not sure if this question is for Priyana or for Reshmi. I was just thinking, like, you told me earlier, I mean, in the conversation, I remember you telling, like, you can customize this device. Well, my question is, if you can so customize, this is something related to the price matter. So will the price also be customized as per the requirements? I'll take this device for 2 or 3, diseases, like, or say, just for example, for 2 diseases, then will the price vary or the price remain same? How is it?
So when we give you the device, we give you with your required program or the disease for the family. So for example, in that we have these 2 diseases already, but rest of the 10 diseases are really not required right now for you. But in future, after 6 months, you find that one more disease program that needs to be added in the device, which is not there at the moment in your device. So we are not changing your device. We just take your device for a week, and we remove one particular disease program from there, and we customize your device with that program that is required by you right now. So there will be a very small charge that we will take from you, very minimum charge that will be charged, that Reshmi can get back to you on this. So it's like very minimum, like peanuts, that will charge you just for the service that is required, because we have a manpower who will be working on it. That's the only reason we're doing that.
Got it. And the next thing is, like, is there any application that you're like, we can connect to our phone, and then we can see all these customizations?
Right, sir. Sir, at the moment, there are no applications, but in future, we are bringing up with that.
Yes, what we said now, it's our upcoming device will be wearable. It will have everything.
Okay, so this one is completely.
It will be real-time monitoring of your parameters also. So it will be cloud-based. So there will be everything.
Got it. Thank you, Mr. Swapnilji. Thank you, Ms. Priyana.
All right, sir. So any other questions, please feel free to ask. In the meantime, I would also like to tell you all that this particular.
Hi, ma'am.
Yes, Vinita, please tell
me.
What's
the price of the device?
So Vinita ji, the price, right, the MRP is 2,50,000 at the moment. That is our MRP, but we are going on with the financial year end discount. Reshmi will get back to you on this, ma'am. We have a discount going on till 31st of March. So Reshmi will get back to you on that. We have a super discount going on.
Okay.
All right. So you see, friends, this device is not only treating your current ailments, but also it prevents you from various ailments in future. It may occur to your body or your family. So like, for example, when we are correcting your parameters, we are bringing your cell charge to its optimum level, where your cells, your entire body perform the way it is supposed to perform. We are dealing every day with smoke, the kind of whatever air we are inhaling, drinks that we are drinking, and whatever inorganic or organic food that we are toxic food that we are eating. So everything is also a responsible to get your cell charge down to positive, and the more positive it becomes, it gets canceric. So cancer doesn't come in one day, heart attack doesn't come in one day. So we can all prevent all of this, and even obesity in future. Like if you're eating too much or whatever you're eating, it cuts down the cholesterol and the fat at the same time with various devices. Okay, we have OnePlus 9 Pro. Want to ask anything, please feel free to ask, sir. I'm not sure your name is.
Hi, Swati. Please go ahead if you have any question.
Okay. So thank you so much, my friends. I think her mute button is not working, or maybe she's just on switched on her mic. So, thank you so much, ladies and gentlemen. Thank you so much for joining us, showing your interest in your own family health and in yourselves. If you have any question, you can please get back to Jivika and Reshmi, all the Bangalore friends, Bangalore guests. Thank you so much for joining us here. And please get back to Jivika for any other query which might occur later. And Mumbai friends, thank you so much. You can please get back to Reshmi if you have any other queries later. So, we would like to wind up the session at the moment. And thank you so much one more time for joining us. Thank you, Dr. Bharti. Thank you, Swapnilji. Thank you, Pooja. Thank you, Reshmi. Thank you, Jivika. Thank you, all our esteemed guests. And Mr. Hemant Rohira was also a part of it. Thank you so much, Mr. Rohira, for joining us. And ladies and gentlemen, wish you all have a great day ahead. Thank you. Keep connected with us. All the best.